Unlike Paul here, I am a techie, okay? And so these are my contact information, but notably, I'm trying to increase my Twitter following. So please follow me on Twitter at Dr. Raymond Lam. I see some of you have actually followed me here in this room. Thanks, Michelle, wherever you are. But I'd like the rest of you to please follow me as well.
Desperate times.
Here are my disclosures, and I'm fortunate to actually be able to contribute to a lot of different areas of research. But today I'm just going to briefly talk about one component of our workplace depression research program. And actually I saw that we had this magazine now, this Moods magazine on workplace mental health here at all your tables. And actually what I'm going to be talking about is in our article here on page 62. So you can tune out now if you want and read about it later on if you want to hear about it. But I'm going to talk about measurement-based care for depression and how we can optimize measurement-based care. And this isn't something talked about in the rest of medicine because it's a given, right? Like, how do you treat someone for hypertension if you don't measure their blood pressure? How do you treat someone with diabetes without measuring their blood sugars or hemoglobin A1C? You simply can't. So measurement is a given in the rest of medicine. But for mental health, as you've been hearing, we don't have a lab test for depression or for any other psychiatric condition. So how can we treat depression if we're not measuring it in some way? Now, even though we don't have lab tests, we have really the next best thing to a lab test, and that's validated questionnaires about symptoms. So when I talk about measurement-based care, I'm really talking about routine assessment during treatment of depression using validated scales that are integrated into clinical care. And these are scales that can measure symptoms, side effects, functioning, and quality of life, because after all, for people with depression, it's that functioning and quality of life that's important. You heard about the importance from Scott Patton of work functioning. That's an important feature for many people with depression. And you can use some of these measurements to make clinical decisions like adjusting medication doses, including other treatments, whether that's exercise or psychotherapies, and most notably, changing treatments or adding treatments if things are not getting better. And so that's the importance of measurement-based care. And we have studies now showing that a measurement-based care system improves outcomes in people with depression compared to treatment as usual. So we've been working at CanMat and other places in terms of trying to promote measurement-based care, teaching or educating physicians about the need to use scales within their clinical practice. And I'll tell you, it's a tough sell. It's a tough sell. Doctors certainly understand the importance of using scales. And actually, many family physicians use scales. They're kind of more used to tracking numbers, perhaps. And you can see from surveys like this that half of them use a symptom scale, fewer of them use other scales to measure things like functioning. Many of them want to use a scale, can't quite figure out how to incorporate that into their practice. And when we ask psychiatrists, well, it's a lot harder to get psychiatrists to use scales. They give various reasons for not using scales. So I have to say that despite all of the educational efforts that we've put into this, the uptake has not been very good. Okay? So we thought we'd take a different approach. We've been trying to act locally, working with the physicians. Now we're going to think globally. And what's more global than the internet? So we thought we would put measurement-based care into the hands of patients. Skip the physicians, go straight to the patients. And we can use the power of the internet and technology to help with this. So probably many of you know that Canada is one of the leading countries in terms of internet use and internet availability. You can see here that 90% of people have high-speed internet connection in their homes. 60% of households use some wireless handheld device, whether it's an iPad or an iPhone or a tablet, to access the internet. And these are 2012 data, so that, in fact, there's been an increase in the number of people who have access to mobile health technology. Just as a little survey here, how many of you have a smartphone with you? Okay, hold up. Yeah, okay. So you all have smartphones, right? Keep your smartphones out. I'm going to have you actually do this. But so clearly, as well, in Canada, in terms of internet use, 62% of Canadians have a mobile smartphone. Okay? And you can see in terms of the number of online hours that in Canada, we're ahead of the game in terms of number of hours online. Now, whether that's a good or a bad thing, at least we know that internet is available to many people. And even to a lot of marginalized populations. I know in Vancouver, our public libraries have free internet access that anyone can access. So what we did was, in our depression research program, is develop an online app, a mobile web app called MoodFx. And you can check this out at moodfx.ca. It was in partnership with a number of agencies, including being developed by our eHealth strategy office in our Faculty of Medicine at UBC, and funded through CanMat, Optum, and Lundbeck through an unrestricted donation. And what this is a way for patients to be able to track their own outcomes. So what it is it's a free, confidential, online tracking website that's optimized for use across a variety of platforms, including computers, your desktop computer, you can do it on your tablet or your smartphone. And it uses validated questionnaires so that patients can track and screen for depression, anxiety, and also keep track of important things like their work functioning. It's more than just a tracking and screening app, though. It tries to be interactive in terms of helping people to do that. Because after all, it's hard for us to remember to complete questionnaires. That's the problem with pen and paper mood tracking. People forget to do it. So with our online app, you can set reminders to regularly complete these questionnaires. It takes about 3 minutes to complete the set of questionnaires. And so you can set a reminder to do it on a weekly or every 2-week basis. And it'll send you a message by email or text to remember to complete your questionnaires, and with a link to the actual site, so you can just click on the link. Once you've completed these questionnaires, it gives you a visual readout in terms of severity of symptoms and impairment of functioning. And you can track this over time on a graphical chart. And so you can see some examples here in terms of some of the screenshots. Very simple, easy to use in terms of tracking changes over time. The questionnaires that we use are all validated scales that are kind of widely used by many in many settings. For work functioning, we're using the scale that we developed, the LEAPS, in terms of looking at work impairment and productivity loss. For depression, the PHQ-9, you've been hearing about it. For anxiety, the GAD-7. And measuring cognition, which is an important aspect of depression, we use the Perceived Deficits Questionnaire, a 5-item scale developed actually at McGill University. Professor Sullivan developed that particular scale. So these are all validated scales where people can track their outcomes over time. Now, they can track it themselves, but we want them to interact with their clinician. And so we encourage them, as they print out these results, to print them and bring them into their clinician for to show how they're doing since the last appointment or since treatment was started. In fact, you can set a reminder. You can set within the app the time of your next appointment, or the date and time of your next appointment with your clinician. So then you'll get a reminder the day before to complete the questionnaire so they're up to date. And you can actually set a reminder so that during the appointment, you can show your clinician on your smartphone how you've been doing since the last appointment. Okay. So this is a way, again, to put some of that measurement into the hands of patients. We have, you can sign up as well, subscribe for weekly tips, self-management tips that help people in terms of dealing with depression, anxiety, cognitive symptoms. And so it encourages them, again, to take part in their own treatment by doing other exercises that are helpful to improve mood and anxiety. So just to finish up, part of this, of course, is a research program. We're very interested because there are a lot of apps out there. Very few of them have been evaluated. And so we're doing a kind of a rigorous systematic evaluation of the app. We have several hundred users now over the past few months, and we're doing our first user survey in terms of seeing what benefits that using this app might have in terms of their own depression care. We're also developing training programs, educational programs for clinicians so that they know how to use this app and when people are bringing in the results, what to do with those results when they see them. We've got some aids for patients, bookmarks. We've got this kind of nifty little ruler. It's good because it's measurement-based care, right? And unfortunately, I don't have probably enough for everyone, but I do have some examples here on the table up here. Feel free to take some of those aids if you'd like. And then we are actually preparing to do a randomized controlled trial of the app in an employee assistance program to see if use with their clients actually affects outcomes in terms of improving outcomes within that clinical setting. So I just want to mention in terms of summarizing that technology can be useful. I think it can help empower people with depression and anxiety to play an active role in terms of their treatment, to make sure that if things aren't getting better, that they're encouraged to go back to their clinician and look for other ideas in terms of their treatment. This is something, unlike some of the great research that you've been hearing about with the promise for the future, is here and now and can be used. So I'm hoping that you will help me promote this. Tweet it out maybe, that would be good too. Thank you very much.